Good evening, and thank you for joining us for Winchester Academy's fall season. I'm Dan Naylor, trustee of Winchester Academy. Please silence your electronic devices if you haven't done so already. If you haven't visited yet, the library's exhibit room is hosting a photography installation by Drake Hawkinson. Winchester Academy's October 16th program is with Drake. We encourage you to preview the exhibit. This Thursday, September 21st, the Wapaka Historical Society is hosting Mark Luden, professor of German American Studies at UW-Madison, with his program, Who Are the Amish? That will be at 6 p.m. at the Holly History and Genealogy Center. Our next program is in 1 week on Monday, September 25th, when Megan Wolf will be speaking on why you can trust Wisconsin's election system. We will be back here at our regular time of 6:30. Our series cookie sponsor is Patricia Pfeiffer, and we'd like to thank her and our hospitality host this evening, Vance Linden. Let's see, Patricia. Tonight's program is sponsored by Kate and Mark Saunders. Let's give them a hand. Tonight's presentation is Linda Hall. Linda Hall is the director of the Office of Children's Mental Health for the state of Wisconsin and believes that the well-being of children has been a primary focus of Linda's career in health and mental health policy. She has pursued children's well-being and increased support for families agenda at the National Governors Association, the Federal Centers for Medicare and Medicaid Services, the Wisconsin Legislative Fiscal Bureau, as director of the Wisconsin Association of Family and Children's Agencies for 13 years, and as interim director for Community Partnerships, the Dane County Wraparound Program. Linda holds a master's degree in theology from McCormick Theological Seminary and a master's degree in public administration from the University of Illinois at Chicago. Since being appointed by Governor Evers in 2019 to lead the Wisconsin Office of Children's Mental Health, she has had the privilege of collaborating with state and mental health leaders, youth with lived experience, and parent partners to improve the children's mental health system and highlight what we all can do to support the well-being of children. I'd like to welcome Linda, friend and colleague.
Thank you, Dan, and thank you for inviting me. I'm really excited to be here with you all this evening. And as the director of the Office of Children's Mental Health, we dig a lot into data. I am going to talk about data, but I hope that we will also have some conversation because the youth mental health crisis really is affecting all of us, and I'm sure there are young people in your life that you are concerned about. So I want to make sure that this presentation isn't just a lot of numbers that don't have any meaning for you. So let's see. I can make this happen. Which way do I go? This way? Oh, wait. Is it on? You know, my mother whenever my mother put a watch on her arm, it would stop working. I think I inherited that mojo. This doesn't seem to be on. Oh, that's the. Oh, what did that do? We just lost all power. There we go. Okay. So, let's see. I'm going to stand somewhere where people can see. So, let's see. Is this on? That's the light. It's the light. Okay. So this is what our office is primarily responsible for, coordinating mental health initiatives across state agencies and establishing and tracking mental health data. Our vision is for children is that they are safe, nurtured, and supported to achieve their optimal health and well-being. We're really focused on systems that are family-friendly, easy to navigate, equitable, and inclusive of all people. And there's work to be done in terms of that. Our systems are not all like that yet. Yes?
When you turn your head to your left, you're much softer than the volume goes
To my left. Yeah. Let's try the middle. No, say something now, that's good. So this is how we approach our work, about the data. We take a collective impact approach to bringing people together to work on these issues for children's mental health. And we have a really strong component of lived experience. So we have engaged with us the high school, college, youth, and parents who have children who they've had to help navigate through the mental health system. And so that lived experience we really rely on. And you'll tell me if you're having trouble hearing me, okay? We really consider youth, we look at the whole spectrum of youth from 0 to 26. And we go all the way up to 26 because that's when kids fall off their parents' insurance. And we know that many children who have mental health, serious mental health issues in their teen years often that follows them into their adult years. And they need to transition into the adult system, which is not always an easy transition. So we're really looking at that piece too. So when you think about mental health, youth mental health, in Waupaca, what comes to mind for you? Who's the first youth that comes to mind? And where do you think that child is on a continuum of wellness? What's working for them and what's not? So Dan is standing up. If you want, I'd like to make this. I'd like to stop several times during the presentation to encourage some conversation, and I would like to hear from you how you answer this question. So if somebody has a comment to make, Dan or Ann will come and.
Okay, when it comes to the mental health of the youth in this county, I'm going to be speaking about my own experiences now. A lot of it has to do with the undetected depression and what's actually being missed by a lot of the professionals. I know when I first experienced it, I was maybe 8. And what really needs to be done is for the professionals to really realize that these things can actually start at a very young age and carry on all the way through. And until we break that, it's going to continue harming the individual.
Yeah, that's a really good point. And on average, it's 11 years from first presentation of mental health systems to when kids get help. So that's a long time. And age 14 is a time when many kids start having issues, and those things carry on into adulthood. And when our mental health is not addressed at a young age, it can have a long-lasting effect.
I think of the children who are the not couch potatoes, but the couch movers who move from home to home to home, which really don't have any stable home life. I think of those children.
Yes, yeah.
I think of what social media is doing to everybody as well. I see a lot of programming being not our typical Lassie and things from the past. I think they're being introduced to a lot of things that are over their heads.
Yes, we heard that. We heard that even from we were holding listening sessions during the pandemic with high schoolers and young adults, and the young adults told us that their younger siblings need to have more guardrails around social media, that they were exposed to too much too young, and we need to do more about that.
Glad to hear that. It's probably related to social media, but I just think of loneliness, despair, being disconnected from the reality of friends and relationships. I think that's just devastating.
Yes, I'm going to talk about connectedness in a little later.
As a teacher for 22 years, I think just the lack of resources, like physical bodies in schools. There just aren't enough people in the schools to help gather the information and the data that's needed to tag those kids and get them the help they need sooner. Not that that's, anything that can necessarily be fixed quickly, but yeah, I think that's what I think, is that we don't have enough people helping in the schools.
Yeah, young people have told us that they're told they're supposed to go to their to the school social worker or counselor, but those people are overloaded and don't have time to talk to them. Yeah.
When I think about the youth and mental health in Wapaka, what comes to my mind is when I was growing up, there were challenges. However, today, what the youth have are so many big challenges that we were never faced with when I was growing up. And it's so important for these kids to have support, to have good friends, and things like that. So the world has changed so much, and we have to really step up what's happening.
Yeah, I agree with you. Let's take one more, and then maybe I'll go on with a little bit more.
Thanks. I think of the causative effects of problems. I mean, the causative things in
The
our
root causes.
environment. Yes. With so many young parents, they're both working full-time. The children, and we have, I understand, a child care desert. If you don't have, close parents or aunties or uncles or somebody to help, and you're just struggling to get enough money to feed your kids, you don't have time and energy to give to them the support and the loving that they need. And I think when we talk about mental health, we really have to talk about our environment and our whole county and what we're offering to help prevent mental health problems.
Thank you. Yes, stress on families is probably the number one factor in how kids are doing. So we'll talk a little bit more about that. So obviously, we are not the only people paying attention to the youth mental health crisis. It's being addressed in all kinds of ways. The U.S. Surgeon General has put out a couple of really good reports on it. The President has a number of missives and guidance for people in the federal government. The National Governors Association has just come out with a playbook for states on things that they can do. And Governor Evers has invested a lot of efforts and has proposed a lot of things. He declared this the Year of Mental Health. In his budget, he proposed over $280 million to address mental health issues for kids and parents. Most of that didn't pass, unfortunately, but he is really committed to it, and we enjoy strong support from him. Let's see. So we're going to go into the data a little bit. These are the top statistics that we look at right now. 1 in 2 kids is feeling anxious. 1 in 3 feels sad or hopeless. 1 in 4 girls are seriously considering suicide. Stop and think about that for a minute. How many girls do you know, teen girls do you know, who might be in that boat? And 1 in 5 kids is self-harming. So if you like percentages, we have the same thing in percentages on the right. And they're really alarming statistics. Yes? This would be high school. It's high school. It's from the Youth Risk Behavior Survey, so it's mostly high school. But we see that when we look at the data for younger kids, unfortunately, self-harm and suicide has increased somewhat on that. There is some good news that the actual suicide rate for kids, for young people 10 to 24 has gone down a bit. So there are some changes in the landscape that we're starting to see. So we talked a little bit before about stress on families. Poverty is a major problem. And so here I'm going to give you some statistics comparing Waupaca County to Wisconsin. And I picked Outagamie County. I'm not sure it's the best comparison, but I think you'll see that there are quite a few differences between the two. So children in single-parent houses, those are going to be households that really are struggling to get by. So 20% or more are in that situation. Children in poverty, the 14%. See, in a number of ways, Waupaca is right in line with Wisconsin. And then you see a few differences. When you get down to the mental health provider-patient ratio, there in Waupaca, it's 940 people to 1 mental health professional. So that's an issue, right? And the primary care physicians is up there because primary care physicians is where children in particular have their first contact with the health system around mental health. So it's usually at a pediatrician's office where the first contact is made. So if we don't have pediatricians having time to see all the kids, that's a problem. And then you can see in terms of the poor physical and mental health days, they're roughly in line with where the state is. So here's some more factors. High school completion, doing really well on that. Social associations, that's important. I mean, when people feel connected and when kids feel connected to their community, that makes a difference. Excessive drinking is a little bit higher than the state average. We actually, a lot of people are concerned about drugs with kids. There are things to be concerned about, but in Wisconsin, we're really more concerned about what's happening with alcohol. And kids in Wisconsin, more than the rest of the nation, tend to think that binge drinking is okay. So that's a real problem, that's a norm, and that's something that we all contribute to. I'll include myself in saying that, we set a community norm that drinking is okay. Not excessive drinking, but drinking. Injury deaths is, I was surprised to see that Waupaca is higher. I can't really give you a whole lot more detail about that. Firearm fatalities, the number one killer of kids right now are firearms. It's been other things, but now it is firearms. And we lead most countries in the world in terms of that. And suicide deaths, here we see the rates, 18 per 100,000. And here Waupaca is a little higher. Now this includes adults as well as kids. And so we know that adult rates of suicide, especially for males, is continuing to increase. And as I said a little bit earlier, for young people 10 to 24, it's come down a little bit. The other thing I wanted to say about suicide, that's an issue when you think about kids, is that For every suicide, it's estimated that 135 people are impacted. So just think about that. If you, I would say every week I hear about a suicide in a school or somebody affiliated with a school, and you just think about all of the young people that are hurt by that and the family, extended family members. So it's a real issue, and firearms are a serious piece of that. Here's a little bit more about suicide rates. Self-harm rates are pretty high, although you're below the state average. And self-harm rates seem to have gone up during the pandemic, although we don't know for sure if that's because it became more apparent. Parents were around and they saw it happening more. They found out about it more than before. But it's serious. It tends to be, girls tend to be more engaged in self-harm. Boys tend to not talk about it as much. There is self-harm among boys, but they don't talk about it as much. And if boys are going to attempt suicide, they tend to do it with a gun, and they succeed. Yeah. Okay. So, but as you can see, these issues are not really skipping over Wapaka. It's happening everywhere in the state. We've recently put out a fact sheet. There's some on the back page, a fact sheet on girls because there's been so much concern about girls. But here you see some of the statistics around it. And you know, the 22% bullied online. We used to see that Wisconsin was, its highest rate of bullying was in-person bullying, like at school. But that is being outstripped now by online bullying. And what I hear from educators is that it's especially difficult for girls because it goes on all night long. The issues, the bullying starts maybe at school and then it continues all night over social media, and that's a big piece of what's wrong with social media is that it doesn't, they don't get a chance to get away from it. Okay. So, but these things, you know, we know that there are these issues for girls. Let's see, I wanted to compare girls and boys a little bit. So you see that the boys more than the girls feel like they belong at school. We know that belonging is really important. Kids who feel like they belong generally have better wellness. They feel mentally better, and they also are more likely to come to school and be a part of that community, which then, of course, affects their academic performance. So we really are very concerned about belonging. You see that anxiety is very high for girls. Bullying and self-harm we've talked about a little bit. And we see at the bottom, you see that a lot of girls are talking about experiencing sexual or dating violence. So these are responses from youth, high school youth, at through the Youth Risk Behavior Survey. And so, you know, if you want to ask a question about the data, one would be, are the girls being a little more honest in answering these questions than the boys are? So we don't know exactly. We can't filter all that out. But we do know that girls consider these issues a problem. When we look at other groupings of students, we see that LGBT students are really experiencing bullying, and more so in Wapaka than in Wisconsin as a whole. They have mental health concerns at a very high rate. And students with disabilities often feel discriminated against. They don't feel like they belong. They are experiencing more bullying than other kids, and mental health concerns. This shows a little bit more about belonging. We've been seeing belonging has been on a downward trend for nearly a decade, and it's very concerning. It's dropped a lot. 60% at least say that 60% feel like they belong, but that's declined down for more than 70%. And half of Asian and multiracial students feel like they belong. Less than half do. And it's even, when we look at Native American students, it's even a lower percentage. We can't always show the Native American percentage because the numbers in Wisconsin are low enough that they don't allow us to report it separately. So we look at national data, and from that we can infer what's happening with those kids in Wisconsin. But again, belonging is that key to, feeling like a part of school, showing up at school, making progress academically, and then again, feeling better. So social determinants of health are really the conditions in which people are born, grow, work, live, and age. And here you see what some of those are. And these social determinants really drive 80% of our mental health and physical outcomes. And that's for everybody. That's not just kids. So these are really the wider set of forces that are making a difference in how kids are feeling. Talking again about family stress, we see that as the number one issue that is a problem for kids. When their families are stressed, they are stressed. That trickles down to them. And financial worries are often the number one stressor for families. So let's see. So poverty is one of the things that we look at, but the poverty level, if you know anything about the poverty, way poverty was set, it was set years ago on a basket of goods that doesn't really represent what it takes to survive. So people have started to look at what is the amount of money a family needs for a survival budget for their household. And so that has been studied for several years now, and we call that ALICE. So these are families who are asset limited, they're income constrained, and yet they're fully employed. And so what you see here is that people are really struggling, and this is these are Wisconsin. It's by different ethnic group, but the families in blue are the ones that are struggling, and you can see it varies a lot. From the second on the left is black, and then if one child with multiple races is over on the right. So this is really, we tend to look at this and at the supplemental poverty measures as indicators of how families are doing, how they're able to support their kids.
I can't read the bottom line, identifying the different
Sure.
colors. Could you read those to us?
Yeah, happy to. It got a little fuzzy when I made it this big. So it's Asian, black, what does this one say? Hawaiian, yeah. Hawaiian. And this is, oh, these people are reading better than I am. It's Hispanic. This is, then it's American Indian Native, and then it's white, and then 2+ races.
It's blurry, but I can.
We got somebody who reads blurry very well here. So. And then I wanted to know what the number of ALICE families in Waupaca is, and you can see that it's higher than poverty rate, and it's going up.
What are ALICE families?
This is the people who are that we were just showing on this on this one. They're families that have just enough money to run a household. So it's families who are living paycheck to paycheck, and they may not be able to pay their rent every month. They've got no savings. They're working, but they just can't make ends meet. And so we're seeing that in Waupaca, there's about 23% of families are in this boat. So, and you see that the blue line is the ALICE families. So this is telling you how many families are really low income, struggling. And that is well above the poverty line, which is the federal marker of poverty, which is really not enough to live on.
And that far left-hand side, is that households?
Yeah, yes, yes, households, yes.
So the number you have there is pretty close to 25% of the total households are struggling to get by. Am I reading that?
Yes.
Right? I mean, because the numbers are a little fuzzy, of course, they're fuzzy all the time for me, but.
Yeah, right. Yeah, I didn't realize they were going to come out so
That's
fuzzy.
all right. It's not just, I'm assuming it's my eyes.
I don't think so.
And that generally means then too that they don't qualify for any assistance from the federal government because they make too much.
Right. Yeah, so the point was that if these families make too much money to get assistance for food and other things from the government. Yeah, and they're working full time and just can't, just struggling to make it. And so they're stretched, and the kids are suffering because of it. Yes.
Is there help for families and from some social service to learn about living economically? I think a lot of families spend their money foolishly and need help.
So the
how to
question,
use what they have.
the question is there help for families on how to
Live economically.
how to manage their budgets well? And I want to share with you in a minute what happened with federal funds that show that during the pandemic that show that families spent their money. They've studied that. Families spent their money on exactly what we want them to spend it on. They spend it on rent and they spend it on food. So I'm sure there are families who could use some financial management or literacy, household budget literacy.
Even
But
things like how to purchase food economically but nutritionally. I mean, many people don't have a clue.
Groceries have tripled in cost. So it doesn't, when you're trying to feed on a single income, right here, single income, parent of a kid in a private college and a teenage boy, I am in that blue, and I wish I was in the dark blue so I could get money to have money. And I shop at Aldi, and I use coupons, and I don't waste food, and I forage. I'll be giving a presentation on that to Winchester Academy sometime in February. I do those things, and it's not feasible anymore. And
Suggesting many people
yeah.
don't know.
Correct. I agree, but then, you want to offer them a class, but they don't have time because they're working 3 jobs.
right.
The unemployment rate is the lowest we've seen, but how many of those people in those studies are working 3 and 4 jobs? So.
No, this is also true, is that families are working more than one job to try to make this go. So what we saw with the pandemic is that money was given to families, child care credits were given to families, and it pulled like 46% of kids out of poverty up into a more livable income. But now those child care credits are being discontinued. So we're going to watch kids fall back into poverty more than before. And as I said, a lot of studies been done on this. I mean, what's frustrating to me is that we know what will make a difference. This is so clear. We've had debates for years about, welfare to work, welfare reform, what makes a difference. With this event, we have studied money being handed to families, and they have used the money. They've used it for rent and food and the essentials. Everything that any planner would want them to use it for. But now that money is being taken away. So food insecurity is one of the things that kids themselves talk about. So this is food insecurity for kids in Wapaka. With kids who are in a family with food insecurity, tend to report more mental health concerns. They feel like they don't belong at school, and they are experiencing bullying. So those are the data. And I'm going to shift a little bit to some of the things that we think about systemically in how to respond to some of this. But are there any data that, in particular, that stood out to you or that surprised you?
25%, that's a lot.
25% is a lot. 25% in the low-income Alice range is a lot.
Well, what bothered me with that graph of the Alice range was that last figure of the blue was up at 5,000 families and the dark blue was down here. But the total population of Wapaka is barely over 6,000. So when you look at 5,000 families that are in that fighting to get by section, that's very concerning.
Claire,
I think
clarify, I think the data is for the entire Wapaka County and not
county.
the city of
for the
Wapaka.
whole county. So it represents about 23% of the county. Yeah, not quite that bad.
The one thing that really concerns me is all these families that are winding up in the cracks.
Yeah.
And it's a shame that nothing more can be done about it.
Yeah. Well, we know what can be done. We know that we can support mental health earlier for kids, and we know that if we help people pay for childcare so they can get to work, and we, help people buy food, pay money to help them buy food, that things get better. So,
Do you have any data that addresses kids who maybe are homeschooled or in an alternative school of some sort or a charter school? Are there differences in those populations?
we don't have a lot of data around that. Charter schools or homeschoolers, they're not reporting data. And a lot of charter schools don't report the data that our public schools report. So we don't have a lot in that regard right now. We might be able to find something if we looked at it at a national level, but I don't think we'd find anything on the state level. So shifting a little bit to, how do we make a difference? How do we impact? This is kind of a presentation of the system that reflects the kinds of things that you need to negotiate if you have a child who needs mental health. You need basic needs, you need medical care, you need insurance, you need treatment. If you want to get treatment in our state, you kind of go through the county. Unless you're on Medicaid. You might be able to get school-centered services. Anyway, it's a complex system, and this is there are lots of ways for people to fall through the cracks here, but this is what we keep working with partners at the state level to try to improve these things, improve people's knowledge of how to get through the system, and then fix the cracks and the fissures between the different sections of it. There are lots of barriers to getting mental health treatment, with one of the major ones being that we don't have enough mental health professionals to address everything. So we have to look at other strategies. We don't have enough, as we've talked about already, we don't have enough support people at school to help with the mental health issues that kids actually bring to school. There are insurance obstacles, high deductibles that families have to pay. They have to choose whether they're going to buy food or pay a high deductible to get a mental health service. And there's lots of paperwork that you have to get through. On the right here, you see Mental Health America is a national organization that we get a lot of information from. And they have a campaign called Before Stage 4. We make kids wait until they're at stage 4 in their mental health concerns, their mental illness, before we give them treatment. They have to fail. This is something that we did make a difference on, that there used to be in state government, there used to be, for Medicaid or Badger Care, there used to be rules that kids had to fail at certain services before they could get a more intensive service. Before they could get a service at home that they really wanted. So we were able to get that piece removed. But there's still a lot Actually, not so much with Badger Care, but with private insurance companies or insurance that you get through employment. You usually have to go through a screening process to be able to get access to a mental health person. And then when you go through the screening process, nowadays, you're actually told to wait 4 to 6 months for any treatment. So if you know a kid who is having crisis, and 4 to 6 months is just too long, And stigma is still a problem, right? So we, a couple of years ago, decided to look at what are all the barriers at different levels, across the age span. What are the different barriers to kids' mental health? And we plotted those out, and we started thinking about, what can we work on, since we take this collective impact approach, which means that we try to work with people from all different sectors. And how do we get everybody working on one thing that would make a difference, that would break us through all these barriers? So with the youngest children, 0 to 5, there's a huge problem of kids being expelled from preschool, which is devastating for families in terms of their being able to continue to be employed, and for kids in terms of their self-image. We see that kids are losing their ability to make and retain relationships, which is not only sad for them, it interferes with their ability to learn and have a trusting relationship with a teacher at school so that they can learn. We saw that the suicide rate for teens was increasing. And then with this older group, we know that there's these issues of transitioning from the children's service to the adult services, and those are problems. So we said, okay, what's the one thing that we could ask everybody to work on that would make a difference? And we decided it was social connectedness of youth. We looked at the national data. The Centers for Disease Control and Prevention actually has done a lot of work in this area, and they recommend social connectedness. We kind of knew that. We came up with this idea, and then we went and looked at it and said, oh yeah, the CDC is doing this. They have a very formal medical definition. We created this definition for us and our network that we asked our people to come together and say, okay, what does this mean to you? And we came up with this definition that we are using as our guiding light for our work together, so that youth are socially connected when they are actively engaged in positive relationships where they feel they belong, are safe, cared for, valued, and supported. So we've had over 120 people working with us on this whole initiative, and everybody had inputs into it. We had mental health professionals, we had families, and we said, okay, what's everything we need in this definition? And this is what we decided on.
Go back for a moment to that statement you made. The children, preschoolers from 0 to 5 are expelled?
Expelled, yeah. Preschool, expulsion from preschool is a real problem. There are more kids expelled from preschool than K through 12 altogether. And it's, well, what it is that kids, they have difficult behaviors, and with their behaviors, kids learn behaviors. They show us how they're feeling by their behaviors. They also learn to use behaviors that work for them. So with those two things, for us to really work well with kids, we have to get behind what's behind that behavior. Why is this kid showing this? And what's the root cause? So what we have identified is that the people who are working with young children need some more tools in their toolkit. They need more ways to work with kids who have some behavior issues. They need to understand better what is developmentally appropriate, and how to work with a kid who has a problem behavior. So there is a whole body of work right now called mental health consultation, and we are involved with folks at the Department of Children and Families who are creating a statewide network of consultants who will be on call for child care centers who are having a problem with a kid, they would be able to call and talk to a consultant who will give them advice on how they might be able to manage a situation. So we also, I'm a strong proponent of school mental health because we know that that works, and we know that when we can help teachers identify how they can work with kids who have particular issues, that we're able to reach more kids that way because they can take that knowledge and use it with additional kids. So on this social connectedness, we said, well, we got to make this a little more concrete. And we identified 5 areas in the center. We identified 5 ways that we thought kids needed to be connected. And on the right, you see the 3 that we decided to work on because we felt we had more of a ability to influence those, and they felt they fit more into our work around children's mental health. So this has been our framework for what we're working on. But as we have been working on the social connectedness, which has been really interesting, we're also making connections with the statewide network on reducing social isolation for elderly people. That's all really good. But as we have been talking to youth, especially during the pandemic, we did listening sessions with a lot of youth, and we've got a group of youth that we talk to regularly. They really have identified for us that they don't hear adults listening to them, and they have ideas about what needs to happen. And so we're adding to our social connectedness of youth a focus on youth voice. So these are the things that youth are telling us are the problem. Academic pressures, gun violence, climate change, political divisiveness, and social media. I think we talked a little bit about this in the beginning, and I heard some of you resonating with these issues. But, when you look at this list and you think about what life was like when you were in high school, you weren't dealing with all these things. That's one of the reasons that we're saying we got to listen to the youth, because they are dealing with things that none of us have ever had to deal with. So we have to hear what their ideas are about how do we approach this, and where do we make connections for them? How do we support them in better mental health? So this is what we've heard from young people, especially related to school. They want teachers and staff, not just teachers, but staff throughout the school to be equipped to talk to them about mental health. They want, teachers are key to helping them feel connected at school, so that's that belonging issue again. And they want school to teach about mental health, and they want days off. They want to be able to take a mental health day. There are efforts, and young people in other states have lobbied their state government to get mental health days. And actually some kids in La Crosse have been working on that for their school. So these are all things that, some of what we're putting in that hat of, youth are giving us ideas about what we should do. So I've already mentioned this, that we had these sessions. We also got a whole list of recommendations from them that we put on our website. And they parallel somewhat the ones that we just went over. So we also keep looking at, there's just a ton of new data coming out around mental health, and we're seeing that positive peer relationships are really very important protective factors, and that high quality teenage friendships really lead to better mental health in adolescence, and that carries on into adulthood. So we're really thinking about that a lot. How do we help kids have good relationships? Because remember, we said that kids aren't doing a very good job of making friends and keeping them. So there's more work to be done in that area. We know that students turn to friends first for support. But as you see in the bottom, down at the bottom in the blue, they turn to their friends and talk to their friends first, but they trust their parents to know what to do. and where to get the best information. And we know that kids who are involved in things, extracurriculars, it doesn't have to be sports, it can be other kinds of things, that they generally have lower levels of anxiety and they feel better. School mental health is just key because it's a place where we already know it's working. I was able to spend the afternoon with the student services team at the Wapaka schools and learned that there are a lot of good things going on here. Your student services teams are working on relationships, making sure that kids have relationships to one or more adult in the school so that they have some supportive relationships to rely on. They are doing regular check-ins with kids to see how they're feeling and kind of monitoring them and giving them support when they're having troubles. So there's some really good stuff going on here. And yet every one of the people on that team said they can't keep up with the demand. Their kids are just coming to school with so much trauma and so much weight on their shoulders that we have to do something about it. And it's really, we have to do something about it because it's getting in the way of kids learning and feeling well enough to learn. So this is important. Another reason that we need good school mental health is because only less than half of kids who are diagnosed and with a mental health condition, less than half of them get any treatment. And of those who do, 75% of them get it if it's at school. Because, there's no transportation issue, their parents don't have to take off work. And in many communities, the school's the only place you can get access to a mental health person. You can't just do it, down the block. So we are beginning to work on bringing youth together who are already leading in their school around mental health. We've identified more than 200 schools that have a peer-led wellness program in their schools, and we are bringing those together. We are through the adult advisors, we're getting to those youth, and we're starting to bring them together for conversations. So you do not have one of these at the high school here. I think there's some interest on some of the student services team's part, but they need more support to be able to do it. So this might be something that people could work on. There are some schools in the Wapaka County, though, who have a Sources of Strength program. Tigerton, Clintonville, Little Wolf, New London, and Waiawega all have Sources of Strength programs in their school. Sources of Strength is a suicide prevention program that also really works with a cross-section of kids to help them learn how to identify strengths in each other and have positive mental health outlooks, positive access, and to raise awareness in their school around mental health. These are other reasons why we want to work with youth, because these skills that we would work on with youth leadership, when they're engaged in youth leadership, it actually promotes wellness, and it's wellness that lasts into adulthood. So I told you that we were like bringing people together. We're creating a statewide youth wellness network, and we're bringing together representatives from all those different organizations, and we're going to bring them together and have them decide what it is they want to work on, and then we are bringing the people from all these different state agencies together to support the youth in their agenda. So we started thinking about doing this statewide network, and then we started looking around, and we found out that there are all kinds of youth councils going on at the state level. So we're bringing the people together and saying, let's work on this together and be more effective and share resources. So I promised you that we try not to talk just about data. We want to talk about what everybody can do, because this problem is bigger than we're going to solve by sending more people to school to become a therapist. And so, we'll spend a little time now on what we can each do. Connection is so important. It's, our brains are wired for connection. That connection is what makes us healthy. So we have to all think about being connected. This is a graphic that we came up with that kind of emphasizes that what our brains need. Our brains need activity. It needs good food. We need good sleep. We need time outside. We need time with friends. And then on the right side are all the things that we need to do from a systems perspective in terms of allowing that people have the ability to do those things on the left side of their brain there. So one of the things that's important to do is to connect with youth. So we worked with some young people, and we did some research, and we found these conversation starters. We have a longer list of these on our website. I want to encourage you, when you're seeing kids in your family, you're seeing grandkids, think about having a conversation with them. We have a child psychiatrist we work with who says the most important thing is to listen. Just to listen to what's going on with them. Let them tell you what's important to them. And if they're not saying anything, you could try one of these questions. I like to say now, we think a lot about how kids are on their phones and electrical devices, their digital devices, and they don't want to talk to you. They want to look at their phone. So figure out how to turn that phone into something that is a connector instead of a barrier. Ask them, what are they looking at on the phone? What's their favorite photograph on the phone? What are they, what are they seeing on the phone that they think you might be interested in? One young person that we had talk about this, he just lit up and he goes, this phone, it's like me, it's like my arm, this is me, And when his grandpa asks him stuff about, what's going on, what does he think, he gets so excited. He's like bouncing off the walls because it's just that critical to him. And we can criticize young people for being so attached to their digital devices, but we also hear a lot from young people that they wish their parents would set their phones down. So we all have a role to play. And I'm guilty of it. We all have a role to play in modeling good behavior, right? So feelings thermometer is one of the most popular things that we came up with. We had a child psychiatrist help us put this together. And so it identifies different feelings you might be having and things you could do to shift your mood if you're in a place you don't want to be. Just the fact that you identify what you might do to shift your mood actually has a physiological difference, makes a difference on you. And so this has been very popular. It's on our website. You can print it out. You can hang it up on your refrigerator. And what we found out is that it's not just kids, but it's adults who need to practice how to talk about feelings.
Do you have these materials in print? Because we can't read those.
Yes, I have some examples of that on the back, and and we have them on our website. That you can print them off our website.
Linda?
Yeah.
Could I share your whole PowerPoint file?
Yes, oh definitely, yes.
So I could PDF that and email it to anybody who wanted it?
Yeah. I kind of talked about this already. Turn that cell phone into a connector. What's your favorite photo? Let's go call Auntie and see what she's up to.
Have them show you how to do something on your
There you go. Yeah. Well, that's one of the things we think about when we want to think about connecting the two generations together. Right. There are some programs that do that. If kids won't talk to you, think about an activity. These are some things you might do, and it doesn't have to be a verbal connection. It can be something else. The key point is to make a connection and have that youth feel like they're seen. They need to be seen, and they need to know that they're valued. And you don't have to do it with words. You can just do it with your presence. Here's some different things. Again, practicing wellness is important, so it's important for us to model it and to give kids ideas about how to do it. These are, modeling and teaching coping skills are important, so you'll get the copy of the slides, and you can look at this in more detail. There you go. You want to live longer? Research shows play with your grandchildren. There are new studies that found that half of grandparents who directly interacted with grandchildren were more likely to be alive 5 years later than those who remained uninvolved. And another study concluded that grandparents who watched their children registered higher scores on cognitive tests than those who never showed up to watch their grandkids. Even without physical activity, you can make a difference in a young person's life. So that's it. Play with your grandkids. That's your job for today. And then we have lots of resources on our webpage. These are our fact sheets. Every one of our fact sheets that come out every other month has lists of things that people might do. What you can do, what your school could do, your community can do to make a difference. If you're concerned about a kid who you think might need some mental health treatment, this is a map that shows you how to get started, how to start to figure that out, where to go to find the steps to find treatment. These are some of the, a number of different things that we have. We have parenting videos on our site, and we have mental health literacy curriculum we developed in combination with the Department of Public Instruction. Those are available for free. And some of it's being used by some people in your schools here. And then we have a whole lot of things. We have a lot of stuff that goes on social media that was designed for us by youth. These are the different ways to be connected with us. And with that, we have a few minutes for questions.